You have a disability, I have a disability, everybody has a disability, because disability is a condition in the body or in the mind that make performing certain activity difficult individually or independently. My name is Hafiz Abdulrazak, the CEO of the Child Expert Clinic. I have promised to take you through the process of disability, and now we are starting with these and congenital abnormality. One thing you have to understand is everybody has a disability. Severity is what is different. Some of us cannot see without our glasses. Some of us cannot eat with a particular component of our teeth because it hurts so badly. So these are other forms of disability. When you come talk about disability, it could be with vision, movement, thinking, hearing, remembering, learning, mental health, or even communication. So disability is not a one thing or a one-way thing. It's a component or myriad of things. Disability can be categorized into three components. Number one is impairment. Impairment has to do with the structure and the function of the body. When your body cannot function appropriately, that is an example. The next one is activity restriction, because the person is blind, the person cannot see, the person cannot walk. It has restricted activity, and also it's going to affect the third one, which is participation engagement. You cannot participate in certain activity. For example, the person that does not have leg might not be able to perform activity that has to do with running potentially or appropriately. Going forward, what are the type of disability? There are a lot of them, but I have grouped mine into four. Number one is intellectual disability. This has to do with the nuance of the brain or the brain itself. How do we identify them? For example, Down syndrome, Fragile X syndrome, among others. The next one is physical disability. This has to do with, of course, apparent structure or changes in the body. For example, dwarfism, for example, lack of movement, brain problem, among others. And the next one is mental disability. This has to do with anxiety, depression, among others. And then sensory disability. This has to do with the use of the sense organs, problem with that. Now, what are the factors responsible or that could be causative factors for disability? One is genetic factors, environmental factors, substance or chemical factors, and we have pregnancy behavior. The way your disposition and your behavior when you're pregnant is a factor. Hereditary, infection, and even your mental health. Now, going forward, you don't have to hold yourself responsible for that because there is no one approach to it. Now, what is congenital abnormality? Congenital abnormality is also called birth defect. It is a problem that has to do with a child before being delivered as a baby or immediately after a child is being delivered as a baby. Problem that a child is born with, that is just the simple term. Now, example are cerebral palsy, could also be, which has to do with the movement and the tissue of the body. Cleft palate, which has to do like hole in the mouth or internally. The next one is brain growth abnormalities, which has to do with multiple bone in the child life, or which another one is congenital heart problem. Imagine a child having hole in the heart. And the next one is Down syndrome, which is chromosomal problem. It's also called trisomy 21, which is like having a problem with the 24th chromosome. How is that your problem? Of course. Now, sickle cell anemia, we have fatal alcohol syndrome, and then we also have the spina bifida. There are others anyways, but one of the things you have to be careful of as a pregnant woman is that you have to get a lot of protein, do protein test, also do blood test. Apart from that, a lot of ultrascan, apart from that, structural abnormalities scan. Medical practitioners can advise you on what to do because it could be identified before a child is being delivered. What are some of the causes? Suggestively, genetics, which you don't have any control over. Medication. That's why as a pregnant woman, you have to be very careful of what you consume. Read instruction appropriately. Substance abuse is another factor. Complications is also another factor. What are the risk factors? What could make you have a child that has congenital problem? Number one is when you are diabetic, that's a potential problem. When you have obesity, and some of the scholars suggest that old age, for example, having a child at the age of 35 or 40, it is suggestive, right? So I don't mean that it is very correct. The next one is also genetic condition, substance abuse, and medication. Now, how to spot it? How do you know a child has congenital abnormality? Of course, when a child is being delivered, the child has abnormal heart rate. That is a concern. The child has problem feeding. The child has difficulty breathing. The child cannot even move when you are moving or when an object is moving, cannot move the heart. That's a problem. And the face, the hair of the child is not looking the way you are familiar with. These are also problems. Everybody again has a disability, and we are going to continue the next episode and the other learning in the next episode. Thank you and bye for now.